Well, trust is very important in the doctor-patient relationship. I think there has to be some give and take and also some back and forth. And I think we try to sit down. I always try to make a point of sitting down with the patient and just listening to them at first before we really go over what we can do for them. So my medical interests really stem around devices and dermatology, mainly for cosmetic purposes, but also for medical reasons. Things as varied as port wine stains to somebody who wants their hair removed. So in the world of lasers and medicine, and particularly lasers and cutaneous medicine or dermatology, we've seen lots of advances. We only like 15 or 20 years ago could do very few things, but now we can do laser hair reduction, we can remove red spots, brown spots, we can tighten skin, we can improve scars. There's a whole host of things that we do, and we're involved in several research projects here at Scripps Clinic that puts us at the cutting edge of a lot of these new technologies. Well, I think patients should choose Scripps for dermatology because we have a lot of good dermatologists. We have over 18 skin physicians that are very good, and we're able to provide care at lots of locations, and we have a lot of collaboration and camaraderie so that if one dermatologist is better at something else, whether it's hair disorders or in my case, cosmetic dermatology, we are very free about referring people back and forth within our specialty. So I think that provides all of our patients with a little higher level of care. Well, when patients come to our clinic, we really talk about all the procedures that we offer, but not in a hard sell way. We really talk about what we can do for the patient and talk about the different technologies we have and how we can use those and how we can make the patient better. But we really emphasize, I think, providing good value. We want to provide value, and if things are not going to work, if I see a patient who frankly comes in and says, I want this procedure, X procedure, and I don't think it's going to work for him, I'll say, no, we need to either do something else or maybe something completely different, something outside of what I can do. So I try to be honest with patients, and I think our entire staff does that. Our staff really rely on each other, and when procedures work, they see that, and they're more likely to really tell the patients how well it works, and that helps us to provide better care. Well, the most fun part of our job is we have happy patients. We're taking patients who may have brown spots, red spots, occasionally things worse than that, but our patients, generally speaking, are going to look better and feel better when they're done, so that makes us feel better too.